Welcome to our video on hypertension, where we'll be discussing how hypertension is diagnosed and the different factors to consider. So, let's get started. Blood pressure actually changes with each heartbeat. So, on average, we experience a maximum pressure, called systolic, and a minimum pressure, called diastolic, around 60 to 100 times every minute. It's interesting that our blood pressure can temporarily go up if we're in pain, feeling agitated or anxious, exercising, or even consuming things like caffeine. But that's totally normal. However, for people with hypertension, the blood pressure stays high most of the time, even when they're resting or sleeping. That's why it's super important to make sure blood pressure measurements are taken at the right times and under the right conditions for an accurate diagnosis of hypertension. To ensure the most accurate blood pressure reading, follow these steps before and during the measurement. Avoid caffeine, nicotine, and alcohol for at least 30 minutes before the measurement, as these substances can temporarily raise your blood pressure. Use the restroom beforehand, as a full bladder can affect the accuracy of the reading. Wear comfortable, loose-fitting clothing that allows easy access to your upper arm. Sit quietly for at least 5 minutes before the measurement to let your body rest and reach a stable state. This helps to avoid the influence of recent physical activity or emotional stress on the reading. Sit with your back supported and feet flat on the floor. Your legs should not be crossed, as this can affect the reading. Place your arm on a table or other support, with your palm facing up. Your arm should be at heart level to ensure accurate results. Use an appropriate cuff size for your arm circumference. A cuff that is too small or too large can lead to inaccurate readings. Remain calm and quiet during the measurement. Talking, laughing, or moving can affect the reading. Take multiple readings at least 1-2 minutes apart, and average the results to obtain the most accurate representation of your blood pressure. By following these steps, you can ensure that your blood pressure measurement is as accurate as possible, providing valuable information for you and your healthcare professional. Hypertension, according to the European Society of Cardiology, is defined as having systolic blood pressure values equal or higher than 140, and/or diastolic blood pressure values equal or higher than 90. This definition is based on evidence from multiple randomized controlled trials that show treating patients with these blood pressure values is beneficial. When measuring blood pressure in a doctor's office, auscultatory or oscillometric semi-automatic or automatic sphygmomanometers are the preferred method. These devices should be validated according to standardized conditions and protocols. Blood pressure should initially be measured in both upper arms, using an appropriate cuff size for the arm circumference. A significant and consistent difference in systolic blood pressure between arms, higher than 15, is associated with increased cardiovascular risk, most likely due to atheromatous vascular disease. If there's a difference in blood pressure between arms, the arm with higher values should be used for all subsequent measurements. For older individuals, those with diabetes, or people with other causes of orthostatic hypotension, blood pressure should also be measured 1 and 3 minutes after standing. Orthostatic hypotension is defined as a reduction in systolic blood pressure equal or higher than 20, or in diastolic blood pressure equal or higher than 10, within 3 minutes of standing, and is associated with an increased risk of mortality and cardiovascular events. Heart rate should be recorded at the time of blood pressure measurements, as it is an independent predictor of cardiovascular morbidity or fatal events. The diagnosis of hypertension should not be based on a single set of blood pressure readings at a single office visit, unless blood pressure is substantially increased and there's clear evidence of hypertensive organ damage. For most patients, repeat blood pressure measurements at multiple office visits are necessary to confirm persistent elevation in blood pressure and to classify the hypertension status. The number of visits and the time interval between visits vary according to the severity of hypertension. More substantial blood pressure elevation requires fewer visits and shorter time intervals between visits. Conversely, in patients with grade 1 hypertension, the period of repeat measurements may extend over a few months. The guidelines also support the use of out-of-office blood pressure measurements, such as home blood pressure monitoring and ambulatory blood pressure monitoring, as an alternative strategy to repeated office measurements. This approach can provide important supplementary information, such as detecting white coat hypertension and mast hypertension. Out-of-office blood pressure measurements are also indicated in specific circumstances, like in people with high normal blood pressure, to exclude masked hypertension. So now you have a better understanding of how hypertension is diagnosed and the factors to consider. If you suspect that you might have hypertension, it's crucial to consult with a healthcare professional for proper assessment and treatment. Thank you for watching. To stay informed on our newest lessons, subscribe to our channel and click the notification bell.